Good morning, everybody. Welcome to today's webinar for SEND partners, parents, carers and stakeholders. My name is Lee Middleton. I'm Senior Commissioning Manager for Children's Schools and Families, and I've been asked to have the honour today of just taking you through today's events. I'm the voice in the background. I'm not going to be on front of camera, but just to take you through things. So let me show you the agenda for today. So in a second I shall introduce you to our panel, Cllr Clare Curran, Councillor Mary Lewis and Liz Mills, Assistant Director for Schools and Learning. In a second they'll introduce themselves. There's a great opportunity for today for you to ask questions of our panel and to put your questions to us. I think there's a couple of things I just wanted to highlight. We are expecting a lot of questions. I can already see over 30 people signed into this webinar, and we had nearly around 100 registered, so we're expecting a lot of questions. It will not be practical in the next hour to get through all those questions. So we have a team in the background who will be collating those questions together for us, and they will put them through to us, and then I will ask them on your behalf to our panel. We will not be able to answer questions that are of a personal or nature about a specific individual or group of individuals that could be identified. So any questions like that, we will respond to you, and our team in the other room will reply to you directly. But we won't be able to ask that publicly because it would be unhelpful and wrong to do so. It's great that we have a large number of you joining us, and do take this opportunity. We've got a couple of polls as we go along too. So in a second, I'm going to hand over to Liz Mills, who will take you through a presentation, and then we've got a series of questions and a poll to break that up as we go along. This is our very first webinar for as a SEND service. It's going to be interesting, and hopefully we'll get lots of questions from you. But we recognise, being the first one, this may not go quite as smoothly as we would like, but we've done our best, and we hope it goes very well. So do bear with us, and please, enjoy. So can I introduce you to our panellists? We have Cllr Curran, Mary Lewis and Liz Mills, and I will just turn on their camera, and they can introduce themselves to you.
Good morning. I'm Councillor Cllr Curran. I was returned in May this year as the councillor for Bookham and Fetcham West, and I've been a county councillor for 8 years. I have 3 children of my own. I've got 3 teenagers at home, and I'm the Cabinet Member for Children. That includes Children's Services, Services for Children with Disabilities, and Surrey's SEND services. Now, Surrey County Council's Cabinet sets the political direction for the Council, and providing high quality services to children and families is one of our highest priorities. Now, Mary Lewis and I are not involved in the day-to-day running of our services. That's the role that Liz fulfills. But we are accountable for the performance and progress to all other councillors, and most importantly to you, to residents, to parents, and those of you who use those services every day. As Cabinet Member for Children, I also hold the role of Statutory Lead Member for Children's Services, and every council has somebody who fulfills that role. That means I have the political responsibility for Children's Services to the Minister, to Parliament, to Ofsted, and to the Department of Education. And so I take that very seriously, because it's so important to us that all children have the best possible start in life.
Thank you, Claire. Good morning again from me. My name is Mary Lewis. I'm the Cabinet Member for Education. Claire and I work very closely together, and you can hear for yourselves that some overlap between her portfolio and mine, and that is indicated by the fact that SEND services comes up in the list under my portfolio as well, and we do work jointly. I'm responsible for schools and colleges, apprenticeships and adult and community learning in the county, and a lot of young people and young adults with learning disabilities would go on to be in our adult and community learning service, where they're supported with their continuing learning after the age of 16. So Claire and I are very enthusiastic as elected members that we represent the voice of parents and of residents, not just in our own divisions but across the county, in telling the service exactly what the experience is like for them on the ground. And having just done a 1-minute silence for the residents of Grenfell Tower, what greater indication is there of the importance of listening to the experience of people on the ground? It also highlights the great responsibility that councils across the country have for different services. We aren't a council that's responsible for housing, but our services are equally important in people's lives, and particularly in the area of special educational needs and disabilities. Like Claire, I'm a mother of 3 children who grew up in Surrey, went to school in Surrey, and therefore we act as representatives of residents, but our experience has been as residents as well, and we know quite a lot about what it is to be a parent, and we can feel, as you do, that responsibility that lies with us all.
My name's Liz Mills. I'm the Assistant Director for Schools and Learning in Surrey County Council, and I'm part of a wider leadership team for children, schools and families. My role is to deliver services, so I'm accountable and responsible for delivery of SEND services, as well as a wider range of responsibilities across schools and learning in Surrey. And it's absolutely a priority of mine to make sure that we're improving services. I have worked for Surrey County Council now for 25 years in a broad range of roles and services, and most recently, and over the last couple of years, working very focused on improving SEND services. For me, it's about making sure that we're really improving the pace and the momentum of that change and the scale of that change, and to make sure that families can feel that change and that their children and young people are really achieving the outcomes and the aspirations that are right for them. So I think that it's really important that we're here today making sure that we're engaging with you in this new way to be able to understand your experience.
Fantastic. Thank you, panel. That's nice to introduce you. In a second, Liz will take us through a presentation. It will take about 5 or so minutes. Just before that, we've got a poll for you. So I'm just going to launch this poll, and hopefully on your screens you will now see the poll. I'm going to give you a minute to answer the question, so please click the answers, and I'll announce the results at the end. Thank you. Thank you for your votes. Right, I shall close that poll, and just to let you know, the results of that was 37% recorded very good, very bad, 33% were bad, 7% satisfactory, 17% was good, and 7% very good. So a spread across all there. I will now hand over to Liz Mills, who will take us through her presentation. And 1 second. Here we go.
Thank you. I'd like to start by actually apologising to families, children and young people who have had a poor experience of our services. I think that poll shows you that there is a spread of experience of families, and we're really very, very conscious, I am very conscious, that we have not been able to achieve the standard of service that we would have liked for all of those families. And so it's more than our statutory duty. We really are dedicated to make sure that we're making those improvements and improving the experience for families. I want to start really today by just taking 5 minutes of your time to recap where we are, think about the work that we've got underway and what we're doing next. And so if we recap on our context, we will remember that we had an area inspection in Surrey by Ofsted and CQC, the Care Quality Commission, in October 2016. They identified 5 key areas of weakness, key areas for improvement, and asked us to submit a written statement of action, setting out how we would go about addressing them. In response, we took several immediate actions to address the biggest areas of concern. That included extending our recruitment staff, making sure that we increased our capacity to address the timeliness and the quality of our education, health and care planning. We brought in additional capability to make sure that we were really able to focus on and drive forward the improvements that were needed. We established the Children's Service Improvement Board to provide some formal oversight to those improvements. And we also held a rapid improvement event to make sure that we were working with families and with partners to address the issues within the education, health and care planning process. Alongside this, we've been working very closely at all times with our colleagues in the Surrey Clinical Commissioning Groups, the CCGs. And we did that to develop our written statement of action. In setting out the actions we take over the coming months, we are being really clear about what the work is that we need to do in order to be able to improve services. The Department for Education confirmed that our plan was fit for purpose in March this year, but there is some further work that we needed to do around agreeing performance measures and impacts. And we've completed that work now. We'll be regularly publishing updates in terms of how we're moving forward and what the progress is. I'd like to use the frame of 4 questions to just talk through some of these areas. What is working well? What are we worried about? What else do we need to know? And what will happen next? In terms of what's working well, we are making good progress in delivering the actions set out in the written statement of action, and we're already beginning to see the impact of that. For example, the number of education, health and care plans completed over the last 12 months has doubled, and we're improving the timeliness of every new education, health and care plan. We've worked with partners to agree on new policies for communicating and engaging with families, one of our key weaknesses. And we've introduced new communication channels, this being one. We've recently held several consultation events to inform, for example, our new travel assistance policy. And by combining face-to-face events with these types of webinars, we're able to reach a much wider audience than we have done previously. Our commissioning strategy will be published soon. This is aimed at making sure that children and young people are provided the right service at the right time, and our aim is to make sure that they're closer to home. Through this work, we now have 2 new free schools which will be coming through into Surrey, special schools, expanding our capacity over the next couple of years by 300 specialist places. And we've also run some pilots, for example, with Rick's Wiki, which is a web-based way of children and young people being able to set out for themselves information so that they only have to tell their story once. And then they're able to share that information with key practitioners, people that are supporting them and their school. And so it gives the child and the young person and their family the ability to have their voice and aspirations very clearly heard. In terms of what we're worried about, well, our priority is to make sure that all children and young people are receiving the support they need to achieve the best outcomes. And we know that many families haven't been receiving that service, the good service that they should have been. And so we're making it our priority to improve that. And in this context, we also need to think about the rising need for SEND services. So more families than ever before have needed services. This is also true nationally, but we're seeing that locally. And so we have many more requests for our support all the time. So in terms of what we need to know, we need to make sure that our decisions are really well informed over the next few years. And these decisions importantly need to be informed and influenced by your views and experiences and those of children and young people. We've seen this working well in recent consultations around travel and short breaks. And parents and carers have been fully involved in putting ideas forward and helping shape new proposals. But we also need to make best use of the data and the information that we collect so that we can really understand how well we're performing and where our strengths and weaknesses are. We'll then use this to drive further improvement and inform the decisions that we're taking. So what will happen next? Over the next few months, we're going to make sure that we're improving and implementing our written statement of action. Alongside this, we'll also be publishing our refreshed SEND development plan. The SEND Development Plan is an update from something we published a year ago. We first developed a SEND Development Plan and was published in spring 2016. And our written statement of action will take our work through to December, but of course this work will go on beyond December, and we need to make sure that we've captured and embedded that important work and are able to take it forward. And so whilst this slide shows some of the things that we'll be doing through the remainder of this calendar year, it doesn't capture everything that we've got going on. I'd like to thank you for listening so far, and now I'm going to hand you back to Lee, who's going to take us through the most important part of this session, the questions and answers.
Thank you, Liz. That's great. So thank you for that introduction. I think that's really helpful. We now know who our panel are, and we've had that sort of context setting. Now is your opportunity to send in your questions. I can see we've got quite a few come through already, and I'm sure this is the tip of the iceberg that we're expecting this morning. So in your dashboard on the control panel on your screen, about halfway down is a question section. If you just make that larger, you can type in your question. You must hit submit or it won't come through. So please do take time to send us in your questions. Our team next door are really keen to hear from you. So just whilst you start thinking about that and we get ourselves ready for the question section, I've got one more poll for you. So this poll's a little different. So there you go, and if you wish to give you a minute to answer that question, and then we'll get on. Well, I'll answer the poll, sorry, and then we'll get on to the questions. Okay, so the last 10 seconds for your votes. You've got your opportunity. Please send us in your comment. I shall close the vote in 2. Thank you very much. And just to share with you the response, there we go, there's the answer. So I think there's some points there for our panel to consider as we take you through the next part. There'll be some still work to do. So thank you very much for your honesty when answering those questions. So I'll now take you into questions, and the first question I have here is from Nikki. Can you ensure that those children and young people with chronic mental health conditions fit into the EHCP process when the forms are very much focused on those with learning disabilities? Can it be a child-centred approach?
Thank you, Nikki, for your question. It's a really important area of our work, and we are developing our services around child and adolescent mental health. And we have a new CAM service which was brought into being last year, and we're wanting to make sure that we're taking stock at the first annual review of areas for further improvement. I think absolutely, if there is further work for us to do about making sure that that child-centred approach is really, we're tailoring those education, health and care planning processes to the needs of all children. And I think what we'll do is make sure that we're just using your feedback today and making sure that we're looking at it again with that eye to make sure that it's centred around the children's needs, and particularly those with mental health requirements.
Am I right in thinking, Liz, that that 1-year review of the CAMS contract, that we were so proud we were able to put 5 million extra into CAMS last year, and that we're reviewing the value for money that we've got for our residents? Am I right in saying that that review will be done with residents as part of it, for parents, families?
It absolutely will. So we're undertaking a review, this annual review, with our health partners, and we will be inviting families and children and young people to participate as part of that review. And in addition, Family Voice Surrey, whilst participating in the review also, will be running their own review of this service. Family Voice are our parent partner and work alongside us in terms of our improvement work, and provide us with really good insight into the needs of families and children and young people. And I would encourage people to get involved in both processes.
I wonder if I could just add, Nikki, you heard that Mary and I are both parents, and we absolutely understand the pressure that comes from mental health issues in a family context. And I sense from your question that you were talking about services that are available when mental health issues have really become more severe. But one thing also I wanted to say is that we are prioritising those services for an early preventative services for mental health to our early help strategy, because it's absolutely important that help is available at an early stage for anybody who needs it, especially where mental health concerns or even poor emotional well-being before it spirals up into more serious concerns. Those services need to be in place as well. So thank you for your question about that. Mental health is absolutely a priority for us, particularly for children and young people.
There's a follow-up question for you. The link between education, social care and health is sometimes not as effective, especially for those who don't meet the criteria from other teams. How can this be improved?
So we're working very hard with our social care colleagues and our health partners to make sure that our services are truly integrated and seamless. And we're doing this at all levels and across all of those organisations. It's something that we'll need to continue to work at, but of course there are a large number of people working in those organisations. But we're trying to make sure that we're establishing a culture where we truly are working together. And one of the ways that we can do that is making sure that our workers all know one another and are able to just pick up the phone, have conversations and make sure that we're providing a much more seamless service. So it's part of our planning and it's part of our improvement work to make sure that we're really driving that forward. But there is some more work to do yet, so I think it's improving and we're seeing signs of that improvement. And indeed I meet every month with my colleagues from social care, both children's social care, adult social care, when we're thinking about those older young people that are beginning their journey to transition into adulthood, and making sure that we're working with our health partners to really look at cases in detail and think about opportunities for learning, think about areas that we can do differently and work on better together.
And we don't know the name of this questioner, do we? But whoever it is, I think you pinpointed something that a lot of people are worried about generally in public services. It's the kind of thing you hear people chatting about down the pub or on the bus, is about how public sector services don't talk to each other very well. They don't even have the same computer system sometimes, so it's very difficult to share information. And right across local government, central government, this is an area that people really demand better in this age of digital services. It should be possible to do it. And Claire and I are always pressing in our role when we go to partnership boards with partners from the health service, the police, education. We're always saying that we really, really do want working together, partnership working and genuine co-working on to put things right for people is a priority. Achieving that is slower than it should be, and that's frustrating for people. I can understand that.
I think, Leah, could I ask for clarification on this? Did the questioner say for those who don't necessarily meet thresholds?
No, it doesn't say that. It says the link between education, health and social care is sometimes not effective, especially for those who don't meet the criteria from other teams.
Yes.
That's all we know.
Yes, because there is something about those who don't meet thresholds, who haven't met criteria. I just wanted to add that one of the focuses of our improvement work is developing our more preventative services, which will help those who don't meet formal thresholds, or and that is also an area of significant improvement work for us.
Claire, if I can interrupt you, there's another question here on that point really, which is what support is available pre and EHCP for, so what is out there that can be used to help parents, families, children, young people that aren't meeting thresholds for an EHCP, what other support is available?
Yes, because this is absolutely cuts to the chase of what we're trying to do, to make sure that our services are available to meet and address problems at the very first sign that they appear, to have a more preventative approach. Maybe you could elucidate on that a little bit, please.
Absolutely. So there's a very wide range of services that are available, universal services that don't require a referral of any sort. And of course, we're thinking about a really broad age range here, right from birth through to 25, and then of course on into adulthood. So that offer is captured in our Send Local offer, and it's available. It's web-based. You can have a look at that online. But the services that can be accessed are everything from supported play and leisure through our short break schemes, support through our children's centres, really thinking about then into school and thinking about the Send support, so pre-education health and care plan, but schools can put in support for those children and young people to make sure that they're well supported, and then of course that can go right through into those college years and so forth. So there's a very wide offer, and I would encourage you to have a look at the Send Local offer in order to be able to try and find out what's in your area perhaps and available for support and suitable for need type and also geography in terms of where things are located across Surrey.
As Cabinet Member for Education, could I dwell for a little bit longer on schools, because I think very often people don't have to have an EHCP, do they? People feel as if nothing happens until you've got an EHCP. But really, we are working on a strategy to get our schools to be much more inclusive and early on to work with the children that they've identified as having particular difficulties, because quite often those difficulties can be sorted out without going down the care plan process at all. And nationally, EHCP applications have risen. I think it's 29% in the last year. But we want a situation in Surrey where people don't feel they have to get driven down that route, don't we?
Absolutely. And our inclusion strategy is really important work for us. Our schools are providing a really good breadth and depth of support to our children and young people. We have good and outstanding schools across Surrey. 93% of our schools are good or outstanding, and 100% of our special education requirements are met through good and outstanding schools. And we have a large number of units and centres, almost 50 across Surrey schools that can support. So there's a graduated response that's available for children and young people. And I think absolutely what's key is to talk to your school about the support that they can offer. And all school websites do have their own offer published so that you can see what's available in each of those settings. In terms of our inclusion strategy, we've had in excess of 100 schools now participate in our Index for Inclusion, which is a method by which schools can really think about how they can improve their inclusivity, and we've seen some really good results from schools looking at different ways in which they can support students.
Perfect, thank you very much. We have a question, sort of generic one, which is around the number of EHCPs has increased in the last 3 years. What is the proportion increase that we've got here? Has the percentage of children with EHCPs risen?
Well, the percentage of children with an education, health and care plan has risen, and as Mary mentioned, that's 29% nationally. In Surrey, that means that we've moved from 5,500 education, health and care plans in 2014 to nearly 7,500 plans in 2017 at this point in the year. And in fact, we had an absolute peak in March this year where we've had 212 plans, new requests for plans, which was the highest figure that we have seen in that one period. And so we've really got you know, a very significant statutory population that we're supporting, and I think it's really relevant and appropriate, therefore, for us to make sure that we're thinking about different ways in which we can meet need.
But I just wanted to reassure anybody who's watching that you don't have to have a medical diagnosis to get help for your child, and you don't have to have, as Mary said, you don't have to have an EHCP, an education, health and care plan, in order to access support. That's absolutely not a prerequisite, and I don't want anyone to think that it is.
Thank you, Claire. Brilliant. I've got a question from Laura for you. This is around building capacity within the EHCP process, and then we'll maybe move on to a different topic. The EHCP, Laura asks, the EHCPs require a great deal of work and thorough understanding of the child's needs. How are you helping caseworkers cope with a large amount of volume, giving them the training they need to be able to write smart EHCPs that really work for children and young people?
So I think the simple answer is that we've needed to expand our workforce. We didn't have sufficient staff, and staff were quite simply trying to issue and work through that complex requirement for an assessment for an education, health and care plan. So we've expanded the numbers, and we continue to do that all of the time. So we're reviewing our capacity and our demand, making sure that we're really thinking through how we can support that. But of course, it's not just Surrey County Council staff where our SEN caseworkers are. We're thinking about health staff, we're thinking about social care staff. So we need to work with partners also to make sure that they are also able to meet those increasing needs and demands. I think it's relevant also for us to be thinking about ways in which we can improve the process. So we're doing work around that all the time, trying to make refinements, and indeed our rapid improvement event earlier in the year really gave us some very good information and feedback from families directly about areas in which we could improve that process. So I think there's quite a lot that we've needed to do. In terms of training and development, if I could just touch on that, we have started a continual professional development programme for our staff, and all of our new staff will be inducted through a new programme which we've developed to help them really start in those important roles very well. And then, of course, just continuing that work. And we'll want to do that work with partners, so training together, coming back to that earlier point about how we make sure our services are integrated, making sure that we're training together and developing our staff together will help.
As you can imagine, Claire and I were very keen to begin with that we improve timeliness, and we were focused very strongly on the timeliness of the EHCP process, and that has improved significantly, so we've been very pleased about that. But of course, looking to the future, we want to focus much more on quality and making sure that those plans are really good, and that they make a huge difference for children. But we weren't doing well on timeliness, were we? And it was important that we got to grips with that, which I think has been successful. The County Council are doing better on that now, and it's 7,200 young people now, isn't it, with the HCPs?
Yes, I think that's
from
right.
5,500.
Yes, and I think forecast increasing during the year.
I think we have to bear in mind that when we ran the poll at the very beginning of this webinar about parents and residents' experiences of our SEND services, it was nearly 2/3 of people who said their experience has been poor or unsatisfactory, and we have to bear that in mind. And so it has been a priority to ensure that, as Liz said at the beginning, both our capacity and our capability, so the number of staff and staff training is prioritised. But also it's the way we work with you as parents. We really must make sure that families and children and young people are at the heart of the work that we do, and we're absolutely committed to making that improvement and making sure that parents and residents feel that we are working with you and for you, and not just designing a system and equipping our teams of staff to work and deliver things at you. We want to make you feel that you are getting the best possible service for you and your families and your children.
I'd just like to say one final thing, and I think that's going out and about and meeting teams. What I know is that every member of staff that comes in is absolutely passionate about what they do, and they come in every day trying to deliver the best service possible. And in the same way as I need to make sure that I'm supporting families, it's my job also to make sure that I'm supporting those teams really well, because they are trying desperately hard to make these improvements, and they're very passionate about that. So I've recognised that we really do need to do more work to support those teams in order that they can support families and children and young people. And I think that's got to be an important focus to make sure that we're getting this.
And I think
right.
we have to be realistic and know that we do still have a lot of work to do to achieve those improvements.
Okay, sticking with our caseworkers in this area of work, questions come from Benedict and Sarah, so it's come from, and maybe a couple of others I'm seeing. What legal training are case officers and managers in the SEND service given?
Well, we do make sure that we've got legal training, and recently we had some IPSI training. I can't tell you what IPSI stands for, but it's a standard, really good standard training, and we've made sure that our staff have access to that and are participating in that. Of course, our legal teams are really very well kept up to date and developing their skills and knowledge all the time, keeping pace with changes in legislation and the case law that develops around this area all the time. So it's a part of our continual professional development model. We want to make sure that we're really making sure that we're driving that forward. And of course, we're doing all of that in line with the Code of Practice. So for anybody that hasn't seen the Code of Practice, it's a DfE guidance document, but it's statutory guidance. So it tells us very clearly what it is that we should be doing and how we should be doing that. And so we're guided very carefully by that document and really making sure that we're developing staff. But again, I would say that I think we need to allow staff more investment of time in some of these areas. They've been battling so hard to try and make sure that they're being really productive and getting those education, health and care plans turned around. And it's a question of balance all the time, making sure that they've got the right skills and investment of time, and we need to support staff with that.
Perhaps Benedict and Sarah could come back with some follow-up questions about where specific, why specifically they think we need more legal guidance, because you're telling us that it's being put in place. But Benedict and Sarah, if you're listening, if you could give us an idea of why you think that more of it's needed, or where it's gone wrong for you, because we are interested in hearing about that. Thank you.
Okay, thank you very much. I'll move on straight on to our next question, which is from Jennifer. Is it fair or illegal for the issue of a child's final EHCP to be delayed indefinitely by the SEND department, who are waiting for input from social services and continuing care? There's all in brackets here, already well outside the 20 weeks element there. So is it fair?
I think the simple answer is it's not fair. I mean, we have a 20-week threshold. It's a statutory time frame that we need to meet, and we know we're not meeting that. We have been able to do work which has targeted that backlog of cases, and indeed we have a specific target in our performance measures around that to make sure that we're really reducing those plans which are well outside of the threshold. And we're reducing initially down to any plan which is over the 25-week threshold, and we've been able to make a very considerable reduction in that area. Over half of those plans were able to be closed and finalised with families so that we had the right plan and provision in place for that child or young person. But it's continuing work. It's work that we are targeting as part of our written statement of action, and I would encourage you to make sure that you're continuing to challenge us, but we have a responsibility to you, and we must make sure that we're making sure that all plans are delivered within that time frame.
Okay, I'll move on. What signs of improvement are there? It's very hard to see on the ground, and surely until families see it, it essentially hasn't happened.
So I think we are seeing signs of improvement. We're seeing signs of improvement in a number of areas. Certainly our timeliness of education, health and care plans is improving, and markedly so. So we're seeing that families will be receiving plans within those 20-week timeframes. And indeed our transfer rates, so where we're moving our statements to education, health and care plans, we're also making sure that we're on time for those as well. So we've got lots of that going on. We've had really positive feedback from some of our new developed services, for example LEAP, which is a service for sort of at the early stage, really early on in that school career, thinking about supporting with children with particular needs. And we're also making sure that we're, through our commissioning work, making sure that we're taking every opportunity to continue to develop and enhance service provision. We've got extra places coming on this year, so we've put on 50 extra school places, which will mean that children and young people are staying closer to home, which is really important for young people to grow up in their community with a peer group, with their friends. And we've also made sure that we've done that longer term piece around planning for the future and making sure that we're bringing on new school places as well. So I think there are a range of areas where we're really trying to focus in, and I think family by family, I'm really hoping that individuals are starting to see a difference. But again, I really do appreciate that we're not going to, I think, see perhaps a groundswell of that opinion for a little while yet. So we're wanting to build that momentum, wanting everybody to really feel that change, that difference. But I'm not sure.
I think this goes back to what I said earlier about we know we still have an awful lot to do to achieve the improvements that we want to achieve. And again, going back to the poll, we're seeing only 3 in 10 of the people, those of you who responded to that poll, are saying that things have been better since the inspection last year, and clearly that's not good enough. We are listening to and working with families to improve our SEND services, but as Liz is saying, we're improving. We're trying to accelerate the pace and the change of the improvement work that we're doing. But I think we have to be realistic and apologise and say you may have had really unsatisfactory experiences in the past. We want to change that for the future, but it is going to take some time. Hopefully, as little time as it needs. But we are really committed to making that change.
Okay, I'm going to take one more question, and then we'll go to a poll to give our panel a little break. So Alice has asked, how are schools being supported to make arrangements more flexible for children with a range of SEND needs? She feels that schools are being asked to take children with a wider range of SEND needs, but they don't always have the support to make these arrangements and it's flexible because they've not worked with that group of need before. There we go.
I think there's further work for us to do here. We are engaging with schools around this issue, and of course our school partners are a hugely important part of this picture for us. And so we can, my own direct experience having visited schools recently, thinking about the more complex needs of children that are coming through, the cohorts are definitely changing, and we're seeing those changes impact schools. And so I think we just need to keep those lines of communication open and make sure that we're working with individual schools and areas on the development plans to make sure that we can really make sure that our pupils are well supported.
I think, Alice, you raise a good point, because the starting point for us is that we know that the outcomes are better for children and young people if they stay close to home. It's in the past, children have been sent a long way from home and out of the county, and we know that hasn't worked so successfully for them in the long term in terms of, you know, settling into adult life and so on. So we've got this focus on staying close to home and inclusion, but we do need to support the schools as much as we can, and they won't all have expertise in every particular special education need or disability, will they? So we do need to support them, but we know that in the end, if we can keep children in their local communities, it is better for them. So it's worth making this change, because in the end the outcomes are going to be better for the children.
Yeah, it's about living, learning and growing up in Surrey, close to home and with your own friends and networks.
Thank you, panel. We've got about 15 minutes left for questions, so this is your sort of last call really to send in your questions. There's a very long list I can see on the system, but do send your questions in. The team next door are really keen to have a look at them so we can group them together and put them to our panel. I'm now going to just launch our third and final poll of the day, so I'm going to give you 1 minute just to answer this question, and then we'll go back to questions with our group. Okay, so your last couple of minutes, a couple of seconds just to record your votes. I can see about 80%, 85% of you have voted. So we'll close that in 5, 4, 3, 2, 1. There we go, we've closed that, and there's the results for you. So have you used the local offer website? About 50-50. So do take a look at the local offer website. It's full of information, and our sort of consultations and engagements and information on services is all available there. So we do encourage people to take a look. Okay, brilliant. So we'll now go back to our panel. There they are, and hopefully you can see them. So the next question I have is from Catherine. Is around tribunals. So given the councillor's comments, how are you monitoring the tribunal rate?
Well, Catherine, we do monitor the tribunal rate. You will have seen during the course of Liz's presentation at the beginning, if you were watching then, she did talk about how we've improved our use of data and information, performance information, and one of the things that we do look at regularly are the information about tribunals, because really we don't want parents to feel that this is the option that they have to pursue. We don't want to end up in that confrontational and expensive in terms of money and resources in tribunals. We really want people to feel that we're offering a service which is flexible and responsive to them. And so we're hoping to see the tribunal information go down as pursuing the tribunal route ceases to be one that people feel they need to take.
This is a whole change of culture, though, isn't it? Culture change is notoriously difficult to achieve, but it's really, really crucial to the whole of our changes in SEND. It's about getting the relationship with parents right at the beginning, and we've been drilling down to the initial phone conversations even, and making sure that the training is better the first time people speak to someone at Surrey County Council about their concerns. As a parent, you come into this discussion laden with anxiety about your child. You have a passion for advocating for your child, and that's exactly how it should be. And if you come across a brick wall at the very beginning, then it puts you into an adversarial mode, and we need to make sure that from the first contact we get it right, so that parents never feel they need to be in that mode. It's draining of the family's energy, and it isn't helpful for the child.
And finally, I'd just like to say that we've made sure that we've really taken a much closer look to see where we can learn lessons. So we're auditing every tribunal that comes through now. We're doing that with social care and health partners, so that we can really make sure we're understanding where it's going wrong and what we can do differently to make sure that we're not falling foul of the same mistakes again.
Okay, so I have a question around culture change, which I think Mary slightly touched on. This is from Catherine. The panel here today is a centralised team. What is happening to prevent the previous disingenuous ethos at the individual geographic level?
Okay, so well, maybe what we'll say is that culture change is really important, and actually that culture change does come right from comes from the leadership, comes from the top. You know, what we do is echoed right throughout our system. And I said before that we've got very passionate staff. They are absolutely wanting to make sure that they're doing the best thing for every child and young person in Surrey. But they need to be well supported, and they do need to see the way in which we want to lead that through. So culture for me is right at the heart of this work. So we are absolutely deliberately trying to affect cultural change, and we need to make sure that we're meeting need, that we're doing that with empathy, and that we're really listening to families and not being so process driven as we actually, you know, don't actually still hear those stories, really understand what the issues are and understand how best to support. So I think it's really important. We've also taken some steps to make sure that we're eliminating geographical difference, so that you don't get a postcode lottery in Surrey, that you should be receiving, everybody should be receiving a really consistently high level of service, and that's what we're driving towards.
Yes. You mentioned the word centralised, and it's true that Claire and I do have an office here in County Hall, but there are 81 county councillors all over the county, and believe you me, we hear from all of them. We hear from them about the experience that residents, that families with children in their area are getting, and we have to be answerable to them. They can ask us in full council, in scrutiny committees and so on. So if you like, they are the eyes and ears all over the county talking to us about the services.
Yes, absolutely. And Liz mentioned that terrible idea of a postcode lottery, and we don't want people to have different experiences if they live in different parts of the county. And this is one of the things that Ofsted and the TQC look at. It's one of the messages that we hear all the time. It's about achieving consistent, high quality services wherever you are in the county, and that's what we aim to achieve. Fantastic,
thank you very much. I'm going to go back a bit around EACP timeliness, but another question from Sarah here. You've talked about significantly reducing the number of EACPs that are running over 25 weeks. how have you ensured the quality of these EHCP plans have not been compromised in order to meet these timelines?
So we've introduced some quality measures as part of our improvement work, making sure that we're not just focused on doing things more quickly, but we're really making sure that we're taking that look at quality, important look at quality. And so we're doing that. So I meet with my counterparts, my colleagues across health and care, and we look at the quality of plans every month so that we're making sure that we take a sample of cases and really understand the quality of them. But we're also making sure that we're doing that right throughout the system. So our health colleagues recently have undertaken an audit of a very large sample of their work with us in terms of their quality of education, health and care plan assessments, the information coming in. And we're also implementing a tool, which is actually something which CDC developed, co-designed. That's Children with Disabilities. I'm going to forget what the last C stands for, but we can look it up. Council. Phone a friend there. And making sure that we're using that tool. So that tool was co-designed, and it's about making sure that we're really looking at paying attention to the quality. And we've, over the last month, applied that audit tool to every education, health and care planning. Health and care plan coming through our system, so that we can really take a really good baseline and understand what the quality looks like and think about areas to improve.
Okay, fantastic. We're into our last 10 minutes, so get your questions in now if you want them to come through. Got a question here from Nikki around children missing their education. So Nikki asks, children and young people who experience school refusal are often not receiving timely or appropriate educational services and are spending months with no education provision. How are you improving this situation?
Well, I think we're addressing that in a number of ways. So we're thinking about our access to education services, so our alternative provisions. So when a child is not at home, is not at school, and they're at home perhaps, thinking about ways in which we can support that education fully. And we have some tools developed which are suitable for some children, not all children, some online tools, online school we have developed, which can help in some circumstances. But we are making sure that we're reviewing those areas, because actually if you've got a child out of school, the answer is that we really need to find the right place and the right provision for that child. We have more recently, and in a few cases, been able to use personal budgets actually to think about alternative ways of making sure that education is in place, where we really need very tailored packages for very complex needs. So there are a number of different ways in which we can address those issues. Making sure that all children get the right education is absolutely paramount. And I think that, yes, we continue, as we do across our work here, to refine and improve. We need to make sure that we are addressing the needs of every child, but perhaps there are some ways in which we're doing that at the moment.
And this is something that we monitor regularly, again through the use of data and information. Mary and I have those figures, and for some children clearly it's right not to be in a school setting. Let's start by saying that, but for others it's an area of huge concern that children are out of school. What they're missing out on socially is as much about their education, and putting that pressure on families. But we are looking at that, Mary and I, on a regular basis, and asking Liz to keep a close eye on that and do something about it too.
Okay, brilliant, thank you. I've got a question from Tanya about reporting bad experiences. So Tanya asks, if a parent is having a bad experience of an EHCP assessment for SEND, who should they contact?
Oh, the first person to contact is your local divisional counsellor. Go on the website and have a look to see who that is. That's someone who will represent your case to Mary and me, and we will be then we're always on Liz's shoulder. So that's a very good place to start. Do that anyway.
We have a number of routes in, so I mean, please do speak with your caseworker. If you have an issue, your caseworker is your first port of call. But of course, if you're not getting the right result there, you can contact our families feedback team. You can do that by email, and it's families.feedback@surreycc.gov.uk, and you can register any concern that you have there if the process and your experience is not going well. And in fact, I have a look at all of those cases that are coming through. So whilst the email might seem generic, actually I see all of that coming through myself. And we work I work very closely then with team members to make sure that we're seeing that the right responses are being put in place and the right actions are being put in place, importantly.
Can I just add one other thing? We heard at the beginning that 2/3 of parents have had experience of poor service, and only 3 in 10 parents are saying that you've noticed any improvement since the inspection. If you are one of those who has had a good experience, or that you are seeing improvements, it would be so lovely to hear from you too.
That's true.
It really does make a difference to
But going
us.
back to Tanya, she's obviously not having a good experience, and obviously we feel for you, Tanya, because as a parent, you know, you're really keen to get things right for your child. But whilst you're doing all the things that have been suggested, don't forget to go in and talk to people in school, because as we've said already, there's a lot that can be done in school even before you get an EHCP, which will make sure that your child is getting as much as they can out of their school. And I didn't mention I was actually a teacher for 20 years, and I was very used to talking to parents in Surrey about their children. And when you work with the teachers, you can usually find something that will be helpful even before the official process has gone forward.
Tanya, I didn't want to dismiss your concerns at all. Please don't take them.
And finally, I just point you to the SEND 2020 email address. So it's send2020@surreycc.gov.uk. And again, that's another route in just to give us feedback, to tell us about any concerns that you have. So we're monitoring these daily so that we'll make sure that we're picking up on those concerns and routing them to the right place. And I think it is really important for us to hear about what's working well, because if we don't know about what's working well and what really makes a difference to you, then we can't build on that and keep growing that really good practice.
Excellent, thank you. Our poll around the local offer has triggered a series of comments, I should say, from users. So basically around number of negative comments coming through regarding that local offer. So what is being done to improve the local offer?
So the local offer is something that we designed with families. We have made quite a step change in the way that we've presented the local offer, but we are continuing to improve that. So our engagement work with families is really important around the development and the enhancement of the local offer. There is a mechanism within the local offer itself to give feedback, and I would encourage you to make sure that you're giving us that feedback, because it's only understanding those areas that you feel are not working that we can really target in on making those improvements. So please do take the opportunity to provide us with that feedback, and there will continue to be events and different opportunities during the year in order to be able to continue to have that discussion about what people would like to see on the local offer and how we can improve it.
Excellent, thank you very much. Okay, so this is our very last question. Thank you, panel. Sarah has asked, staying within the county, this is around placements. So staying within county is all fair, but if you don't have the right type of school available, children do have to travel out of borough or out of county, I guess. As you say, the cohort is changing. Will you introduce more schools that follow different approaches? She's highlighted the applied behavioural analysis approach instead of just more of the same.
Yes, we are constantly looking at ways in which we can enhance our own school provision, and indeed the 2 new free schools that will be coming through into Surrey over the next couple of years will do exactly that and start to think about addressing those needs and thinking about building on good practice. We have a really good number of special schools already in Surrey, and they really do have a lot of good practice that we can be able to embed in our new schools, and we're seeking to expand that all the time. I think it's really important, though, that we do continue to understand what works well for children, and in fact our LEAP provision is an example of that. So I think we'll just need to make sure that we're, again, constantly reviewing, making sure that we're seeing developments across the country and in other countries even to see what's working, what's developing elsewhere, and trying to put that into practice in Surrey.
As an example, I went to visit one of the new Cllr centres last week, and it was fantastic to see how children with autism can be, when it's suitable for them, can be in these centres which are attached to mainstream schools, and they can go in and out of mainstream education when it suits them, and then they've got a safe place to be taught alongside it, and all kinds of innovations are happening, really, aren't there? You mentioned about the 2 free schools, and they're slightly different. One complex social and communication needs, and one communication interaction needs. So we are looking to have a more diverse offering in every possible way whenever we get the opportunity. So thank you for bringing up the question, but it is something that we are doing as much as possible.
And I think that there will always be those occasions. I think those schools which are outside of our direct provision will be necessary on occasions to make sure that we are meeting those very specialist needs. But being close to home, that's really important for us.
Excellent. Thank you, panel. That's the end of the questions we've had today. Lots around the EHCP process. I just wanted to give you a final opportunity to say sort of final remarks or comments to our audience before I bring us to a close.
Just like to thank parents for being willing to join in with this webinar. This is just one way that we are in communication with parents, but it gives an opportunity to people who might not find it easy to get out to a public meeting or to a particular venue. You can do it from home, and hopefully this is fitted in well with your morning when perhaps the children have been at school, or you've got a little bit more opportunity to talk to us, and we have appreciated it. So thank you very much.
Yes, and we do want to engage more fully with a wider range of families as we go forward, and we plan and evaluate the services. And we just to reiterate that we really are and we want to listen and hear from families and your experiences to make sure that we can improve our services in the right way. Mary and I, as I said earlier, we're not involved in the day-to-day running of the services, but we do challenge and hold Liz and her team accountable for the performance and the progress. And so the more we hear, the more evidence that gives us to go back to our officer teams and our officer teams in the county and present them with what we're hearing.
I'd just like to say thank you, and thank you for your openness, your willingness to engage in our first webinar, and do please give us feedback so that we can learn and continue to think about how we can engage and improve on this experience for you. But also do please continue to give your feedback. It's so important for me to understand how families and children and young people are receiving our services so that I can make sure that we've got the right work underway. So I really would encourage you to keep providing that feedback and challenge.
Fantastic. Thank you, panel, and thank you for your time this morning. Just a few remarks from me. This was our very first webinar across the whole centre. There'll be a number of these going forward, and they're likely to focus on key topics. So do send us your comments about what topics they might be in the future. We've certainly got one coming up. I think the next one's on transport with myself leading the transport project, but there are others in the pipeline. So do get involved. Do keep an eye out for the invitations. We'd like to thank you for joining us. It's gorgeous weather. We can see out the window here. So thank you for your time, and do go out and enjoy the weather, and do check in with us again in the future. We welcome your feedback. So at the end of this webinar, we will send everybody who participated an email with a short survey. It'd be great if you could just give us your comments that we can then sort of take that on board, and we'll improve these as we go forward. I'm going to leave the question section live. So if you've got any comments about how this webinar has gone, and you want to just quickly type into the question section, although we've now completed our presentation and the questions to our panel, we'll leave the question section up for the next 10 minutes, so you can just send any final comments you've got regarding how today's webinar has gone and how you might think it can be improved. But do look out for that. Do look out for that survey. And thank you for your time. Have a good day. Goodbye.